Welcome back, everybody. This is the Prehospital Paradigm Podcast. I'm Scott Wildenheim, again with Dr. John Hill here, and we have a very interesting episode. I actually can't wait to get in this. I know bits and pieces of this topic, and I want to understand more. But we have sitting across from me Chris Fredmonsky and Tyler Carlton from Streetsboro Fire, and and I imagine in our local realm, most everybody knows this story already, and I think it even made some national news as well. But Chris actually suffered cardiac arrest in the middle of Dr. Hill's presentation while he was out doing CE at Streetsboro. And so we basically have an episode of saving our own, and we want to just tell this story from multiple points of view. Obviously from the patient's point of view, which I'm very intrigued. Obviously we periodically get to talk to survivors of cardiac arrest, maybe even lucky enough that we personally have saved, but to have both a paramedic that is the patient and then can give us both sides of that. I'm very intrigued. And then clearly, Tyler, you were there. What was your role in you were just the guy sitting closest to him, or are you just here because you had to write the report? Oh, what was that?
No, I was not the one writing the report. Actually, none of them wanted to come in and talk, so I had to be the one to come in.
Oh, okay. All right, fair enough.
But
short straw.
Hey,
yeah, basically.
Hey, fair enough.
I was the second closest guy next to him.
Okay.
No, I don't. Do you want me to go into the story?
Oh, well, we'll get to that in a second. I basically, why are you here, right?
I'm here to talk to you about his story.
What his story? But you were part of the resuscitation team,
yes.
Right? And you just tiptoed out of the room, pretended like nothing happened, right? So,
but you stepped away.
Yeah, you're like, you guys got this.
CE's over.
Yeah.
Later. I didn't see him most of the time.
This is a crime scene now.
So let's talk about the lead up to this. So you were there. What was it? Just a regular CE? What were you doing there to begin with?
It was a regular CE, scheduled with most of my squads that go out and do an hour, 2 hour run review. We were finishing up run review at the end of ours. I typically start with all the high acuity stuff and then end with the sign-offs, which are high risk.
Super high risk, yeah.
And literally said, we're going to do one more.
It's always the last one.
It's always the last
Always the last one. Chris, leading up to that, I mean, how was your health in general leading up to that?
It started like any normal day.
Yeah. And then, what had happened was?
I've had a sleep apnea problem that went undiagnosed for a number of years.
Sure.
I've probably been on a BiPAP for about 10 years now.
Okay, yeah.
And with that, it caused basically slightly enlarged heart, myocarditis, just thickening of the muscle.
Yep.
The guys told me for years, I've been doing this 31 years now, and they could say some of the guys that we'd sleep in the same area, they'd hear me stop breathing. They
would hear the apneic periods.
So I finally got that under control. Have been doing much better with that over the years, but really nothing else other than that. Just that, and I've got hypothyroidism. It's basically those two things.
Yeah. I mean, how many people do we go on every single day with?
More than that.
More than that.
Oh, yeah.
Mm-hmm. Just the big confounder there, of course, is the sleep apnea, right?
Yes.
It's the one that really pops out, but still. So you've been with Streetsboro that entire time?
1992 I started.
92.
When we were basically first year as a volunteer.
Yep.
And then we were part-time after that, part-time paid. And then started full-time 2002, 2003.
Been a fire medic the entire time?
Medic since 02. Basic started in 92. Became an advanced for a year or so, and then went into medic school.
That's sort of my story, right? As I did a year as an EMT, and then a couple of years as an it was an intermediate EMT at the time, and then transitioned into paramedic about the same time frame. So that's kind of cool. You started before I did. Yeah, you got a couple of years on that, then. But. I was a medic in 99. Went to in 99. Started in 96. So
yeah, I went through medic school in 2000 and Graduated in 2001. Yeah.
So, Tyler, how long you been with Streetsboro?
A year.
A year.
A year. Yeah, I was there for a year.
So this is like your second run review, and then all of a sudden you're put to work.
I'd done a lot of them, but I didn't expect that to happen.
Of course not. I don't think anybody would expect it to happen. So leading up to that, had you felt okay? Was there any warning signs?
No, I mean the normal fatigue for working multiple jobs.
You mean you work multiple jobs in EMS?
I know it's kind of crazy to
I
think that, but it does happen occasionally to some of us.
All of us.
The Hollywood pay that they pay us just doesn't always cut it.
Comes up a
Lavish
few dollars
lifestyle you have to maintain in front of everybody. I mean,
Maintain a particular
yes, I
lifestyle.
mean, just having the posse around you all the time, it's not cheap. So yes, I work another part-time department. Usually work 12-hour days there. Work my 24th Streetsboro. Then on my day off, I do stuff on the side and keep busy as with all of us.
All of us, yeah.
So it's sun up to sundown sort of thing.
Felt generally well that day?
Yeah, I really had no complaints. My general fatigue, which is normal. My wife did say afterward that I looked very tired that morning when I left for work, and she was like, we'd had a busy weekend, had a couple things, family events and that, and she just said I looked really tired going into work that morning.
And this was a Monday? This was
Monday morning,
This was a
January
Monday.
9th.
And
Got to work like normal.
had you worked a second job over the weekend? Or
No,
you had a whole weekend off.
I had 2 days off.
We call that a golden weekend.
Oh, it was nice.
You were exhausted from not working.
Exactly. But yeah, went in, normal morning, had breakfast with the crew, went out, did our truck checks, normal morning cleaning. We had our CE coming up we wanted to get ready for. I remember the doc getting there. I remember coming into the room, sitting down. There was an EMT student riding with us that day. He introduced himself, and I was like, I think I graduated with your mother. And he's like, yeah, my mother. So it was like, small town Streetsboro.
Right.
There's a connection there. I can remember him introducing himself and us talking briefly. And then I don't remember any of the lecture.
That's fair.
So I apologize for that, but I do tell everyone that, everybody's like, oh my gosh, did the doc bore you to death? Whatever. And I'm just like, the doc saved my life. He gives a killer lecture. You got to go see one of his lectures.
For what it's worth, there has been absolutely no lack of harassing him as soon as we found out you were okay.
Free pacemaker with every CE.
I haven't seen the bill yet.
Hey, that was my line. I get credit for that.
But yeah, no chest pain, no shortness of breath, no complaints I can say that day that I remember anyways.
Yeah. And immediately before the event, just nothing.
No, I don't even remember. Like I said, we were over an hour into the lecture, weren't we?
We were 2 hours.
Yeah.
I was literally doing the last one.
Always the last.
It's always that one, just one more, guys. So just remember when somebody says that, be like, no, maybe we shouldn't do just one more.
If he says it, definitely. No more. Where were you physically to Chris when it happened?
So I think we had a full shift since Streetsboro's a combo department. You have part-timers and full-timers.
Full-timers, yep.
And all the recliners were taken, so I grabbed a chair from the table and I sat between two recliners.
Yeah.
And the other guy was back on the breakfast counter.
Breakfast counter, yeah.
Yeah, breakfast counter. He was sitting there next to him. So Chris is at the end of the table. Other guys at the end, counter. I don't know if I'm allowed to use names or not in here. That's going to be, if people are uncomfortable with that.
Dude.
The other dude.
The other dude or dudette was that?
Firefighter 1.
Yeah. And then there was I right there.
Yeah.
And then hear a thud. Someone's getting into a tussle, in a fight.
Yeah.
You look around, you hear, dude, you all right? You look around, he's on face down on the floor.
And you were in a recliner or you were sitting in a...
No. So, I specifically, whenever we have CE or anything, after doing this for so many years, I know not to sit in a recliner because I may nod off at any time.
You're going to take a nap.
Period. So I sit at the end of the table, sit upright, try and, maintain and watch everything.
Right. Pretend.
Yeah, because I know if I sit in a recliner...
It's lights out.
Yeah.
Fair enough.
It's going to happen.
That's for all of us, right?
So it's probably good I didn't because I may have just nodded off or this may have happened and they just might have been like, oh, hey, Freddie's sleeping.
Hey,
somebody go wake him up.
Yeah, and it's been too late.
Yeah.
That's what. How many people were there? I mean, 6, 8, 10 people, or are we talking 20, 30 people?
There
Or?
had been at least 8 or 9.
Monday, I think we had 7 on shift. Scott was in prevention,
And then with the student.
but he was there. The student, yeah. So we had at least
And had the doc, too. So, I mean,
So
Yeah,
8, 10,
probably
8,
8 to 10 people.
8, 10
Yeah.
people there. Just thought you just came off the chair.
don't even remember it.
That's nuts.
Yeah.
All right, were you first on them, or
I got up and looked. I walked over there immediately. The other guy, to say Lamonte. It's just, I don't know why I said the other guy. Just say Lamonte. He might be watching
That's
this. So I'll give him
L-A-M.
at least some
give
credit.
him the credit? Yeah.
And then we both were like shaking, like, "Hey, Freddie, you all right, Freddie?" And it looks like he's having a seizure. Honestly, it looks like a seizure. He's getting really red. He's not convulsing, but he's shaking.
Yeah.
And it feels like his throat's all tightened up, so he can't, like, he's trying to breathe. It slows down. He was actually on his back, and then we rolled him to his side because he wanted to vomit. And then didn't go limp. It was kind of like that.
Yeah.
And then we go get everything, bring it in. Guys go out to the bay, bring the cot in, bring the monitor in, put on the monitor.
First.
I just put the 4 leads on. And it shows the fib.
Yeah.
But I was already reaching for the pads. I'm like, well, this is probably a pad scenario just in case. Let's
Of
put
course.
the pads
Right.
on.
Yeah.
And it was just perfect at that moment. Just lit up 200 joules, shocked him, picked him up, threw him in the cot, took him to the squad.
First
Started CPR.
Is the wherever you were having your meeting same floor as
Yes.
as the apparatus bay. So the from your point of view, what I mean,
So I was farthest away from.
clearly you got to be like, are you kidding me?
Yeah.
All right.
Gotta work today, man. I remember going there. I remember asking people if anyone like knew your past medical history, like especially seizure disorder, because it did look like you were having a seizure. You were, because your brain was losing oxygen and was essentially firing everything it could, and it looks like a seizure to us when people go into cardiac arrest and the blood flow stops to the brain. We all watched you take your last breath and literally arrest in front of us. So quickly, pads were on, shocked you, loaded and went. Now, load and go still means could get you on the cot, straps, had to get you. We didn't pull out the ambulance. We wheeled you while we're doing CPR out to the bay. Kind of snuck you in, didn't pull the ambulance out to get you back in, got you loaded up. They went to go drill you in your right tib fib.
Didn't they do the left?
Yes.
Yep.
So I asked
Humeral head.
if they do humeral head because it's closer to the heart, and just did ACLS, as everyone's been trained to do.
Your arms are too muscly. We had to put a second one in.
Yeah, that's what I heard. Yeah, the knee still actually. If I go to kneel down, I have a lot of pain in that knee all of a sudden now. So I don't know if there's still a fracture or something in there. It's really weird.
Lamonte put the IO in. If you want to name anyone specific,
I was told in the ICU that when they went to pull it out, they had to get help to pull it out because it was in there. So it was
Claw hammer and
buried. Almost. They said literally the first nurse could not pull it out, and they had to get help to pull it out because they didn't want to dislodge.
that's
So
nuts.
it wasn't going anywhere.
no,
it was.
it's a great line.
Oh, absolutely.
So presenting rhythm is VFib.
Yep.
VFib. You counter shock him immediately at 200
200,
joules.
yep.
He laughs at that.
He laughs.
He laughs at that. No.
I just want. I'm hoping somebody at least said, "Freddie, you're going to ride the lightning now," and then they hit it.
So
I was thinking in my head, but I didn't know what they were
Okay.
going to say it.
At least there was a thought.
so
Neil Armstrong planned his first words. You should have these like in the bag ready to go.
wait,
I'm only a year on. I still got to figure it out.
And next time you shock somebody,
he's like, wait, I wrote this down. I have one specifically for this case.
wait, elderly
But guys, don't do anything
female.
else.
Right.
Hold on.
Everything
I gotta get
stops.
this. I gotta get this right.
I got a zinger here. Somebody's filming this, right? So you hit him with 200, and you wind up out at the truck. He's still in VFib at this point.
Yep. So we're still continuing CPR. We get him loaded into the back
Apex
of the bed.
sternum pad placement or anterior posterior?
Do you remember?
Apex.
Apex sternum. Yeah. Okay.
And I had his brain fart for a second. I was like, oh, yes.
Got to watch with those big words, okay?
Yeah, you confuse me.
Front and back, front and side, small words.
Front and side, right? Is that what we're talking about? Yeah. So front and side. You shocked him once, no go. We get in the truck. We're working on some access. Manual CPR going on at this point?
The entire time.
Manual CPR.
The entire time.
The entire time. Yep.
No,
If you haven't noticed,
no
I'm a larger guy with a barrel chest, and unfortunately, the Lucas does not lock in place on me.
that was the question that
Yes.
I'm kind of leading to is, was it tried?
Nope.
It was not tried. It
or
was
you,
there.
you just said, look,
We opted not to.
we know he's not going to fit in here. And
No,
just
literally,
straight-
we've tried to put it on me in the past in training just to see.
Oh, no kidding.
Like, swear to you, especially when we first got them, we were like, this might not fit everyone. And then they're like, Freddie, lay down, see if it'll fit. All right, let's see if it'll
just
fit
to
around
understand
me.
on a bigger individual
Yes.
how it's going to.
So some of the guys that have been there with me for a while probably knew right
Absolutely
away.
knew it
It's not going to
wasn't gonna
fit.
work.
Don't take the time.
Right.
And let's just do manual
I mean,
CPR.
that's information we wouldn't normally
Yes.
know about about a patient, right? Is like, oh, he's going to fit or he's not going to
Yeah.
fit a particular tool, right? So manual CPR, we tried a tibia, landed that or no? Or we also put in a.
We got the tibia.
Yeah, this one pulled out.
Oh, got it. Okay.
Humeral head pulled out.
So
and
you
then they went
flexed
tib.
flexed your muscle and shot it.
Apparently.
So what had happened was we got him back and got him loaded up.
Yeah.
Asked for the IO.
Yeah.
It'd been a few minutes since we did our last pulse check. Pulse check still VFib. Shocked him.
Yep.
Dislodged.
The shock
shock.
the shock dislodged him.
Yes.
Wow.
So got secondary access. We intubated him while in the back of the
While in
bay.
the- in the-
Yep.
okay.
They were successful doing that.
And what technique used there? Was that video laryngoscopy?
Classic
Ju-
laryngoscope.
Just
Just
old
direct.
school steel blade.
Yep.
Did you do it?
I did not.
You did
Captain
not.
did it.
Captain did it. Spot on. Just good old school.
I was in the back shaking, trying to drop drugs. I mean, you don't think about what's going to happen to someone you're working with.
No. And that's some of the
I
things
don't
that
blame you one bit, man. Not at all.
some of the stuff I want to tease out of here today is it's easy to kind of disassociate yourself when it's just lay public, right? When it's friends, family, and frankly, it's the service is a family, right? It's all that stuff comes into play. I can imagine you were shaken, and I wanted to, hear if that was the case for all participants or just select participants. That's it's a hell of a set of cards to be dealt. It really is.
After talking to a couple guys couldn't even go in the back. So if we're gonna be honest, like majority of the guys in the back, half of them were B shift guys. I was covering off a different shift.
Got it.
So a lot of guys in the back were like A or C.
Got it.
They weren't
Not
B
his,
shift.
not your guys.
There's like maybe like one guy.
Yeah, no,
Like
that's
one or
that's
two guys.
that's a heavy lift mentally. It really is. So you've got basically the other shifts working on you, which from a perspective of being objective, is great, right? That works out beneficial for you, obviously. The second counter shock still no go.
Yep.
And
And
we're-
I was paying closer attention with this one. We gave the shock, and I watched afterwards. You converted, and then right back to VFib. Like seconds, I saw a few regular beats, and went right back to VFib.
Couple narrow complexes, and then he's right back into.
Yep. So I'm refractory at this point.
We're persistent at sure.
So,
Now-
sorry.
No, I was gonna say, the point that I wanted to make coming in here, because I heard bits and pieces. I started off saying I heard bits and pieces of this story, but I haven't heard the entire thing laid out, and I certainly haven't looked at the report and whatnot. And the thing I wanted to stress here was early BLS, or early intervention, early defibrillation. This was actually an ACLS save, right?
Yes.
This was just the beginning. You guys got after you guys had that access, that second counter shock. You got kind of deep into drugs and beyond just kind of the normal protocolized stuff. You were obviously calling for some stuff and authorizing some stuff real time that we certainly could call medical control for, but don't often do. So. What meds? I mean, what's the list of meds that in the? And you guys are still in the bay at this time.
We're still in the bay. we got our tube, we're securing it.
Yep.
First drug is going to be
Epinephrine.
perfect.
Zappy, yeah.
Always.
What was his initial CO2?
High.
Oh, it was okay. Good.
60s.
Oh, good. It's
You had great CPR.
no. That's
Apparently so.
seriously telling you you've got something to work with there. That's fantastic. I know on somebody you're doing compressions on to have numbers, and boy, that stays way up.
Doesn't it?
Wow. They were doing rock star CPR
Yeah, I
on
can
you.
see it.
So almost throughout the entire event, CO2s
Yeah.
50 and 60.
Yep.
I
That's
can vouch
crazy.
for the good CPR because it hurt when I woke up.
Does it still hurt?
Yeah, it was I don't know at one point, but I did regain consciousness in the back of the squad for a couple seconds.
Sure.
And it just felt violent.
I can only imagine.
I don't know what we were going down the road at that time,
Yeah.
I'm assuming, because
We're on 14 at that point.
I saw the monitor. I was bagging him at that time because I moved over to bagging because we were switching over to the CPR.
Sure.
I think 3 people worked on you on CPR
Okay.
at the time. We just rotated. Like, we just knew when to switch. This is perfect. And,
What you train for, right?
yeah. Because usually when you have the Lucas, you don't have to worry about it.
Correct.
And then you have to have someone else go on the manual compressions.
Nobody was calling for it. It was just like, all right, and then just
Yeah, just moving.
step up.
You look tired, next person moves over.
Hopped on.
And I was bagging them, and after we give every drug before we go back and the other drugs, we're still talking about that.
Yeah.
I'm looking at the monitor, I'm like, Dr. Help, the monitor, it looks like the rhythm's changing a little bit, and then that's when he sticks up his thumb and gives, I'm good.
You gave him a thumbs up.
He gives a thumbs up.
so the first memory I had was I don't know if you can imagine laying on a cot and kind of feel you could tell you're in a vehicle, you're in motion.
Right, yeah.
And then I heard something, and I'm going, I know that noise. That's somebody's being bagged. And then as soon as like that conscious thought went into my brain, I felt the tube, and I'm like, and then I felt like the compressions. It wasn't just the motion of the squad moving; it felt like somebody was stomping on my chest.
Sure.
I mean, I was just like, and I'm trying to think, what is going on here? You know, like, and it was just violent. I mean, it felt like I was just being crushed under something. And I thought somebody said, Freddie, you're okay. So I don't know if that's I grabbed for the tube or something. And somebody said I was okay. And I remember I gave him a thumbs up.
Wow.
And then I think somebody said,
You got 250 of ketamine at that
yeah,
point.
doc's going to give you ketamine. And I remember hearing somebody say that, and I think before I could even register it, I gave the okay sign, and then that's it. I was out again, and a couple days later, I came about. I didn't remember anything else for like 2 days.
Wow.
Yeah.
That's crazy.